All right, you guys, thanks for signing up for the career speaker today. Kristen Eel, who's going to be talking to you guys today about her path in career in physical therapy, was actually a previous PED student. So although this room didn't exist when she was a student here, she used to roam these hallways. So it's kind of neat for us to bring back people who were once in your shoes not too long ago and have pursued a career and can come back and kind of talk to students who are interested in whether going into physical therapy or another field that's in health science. She can kind of speak to that, but I'm going to hand it over to her and make sure to ask questions. This is a great time to do that. So thanks, you guys.
Thanks, Brandy.
Yeah.
So, all right, who is in 7th grade? A couple of you. 8th? A lot of you. 9th graders. Awesome. So, yeah, I was kind of reminiscing about when I was at PED as I drove to the parking lot, and I'm thinking, wow, that's been a long time ago. I think that was 2001 to 2004 or something ridiculous like that, so it's been a really long time since I was at PED. But it's cool to be back here, and I was trying to think also, where was I at in my head when I was your age thinking about a career, and like, would I have even signed up for career day? I don't know if I was that forward thinking, but good job, you guys. So as far as your healthcare ideas or like career ideas, who is like, I want to be a physical therapist for sure, like that sounds awesome, sign me up today? Anybody? Yeah, we got one, maybe, a couple maybes. And who's like, maybe physical therapy? I don't know what it is, I just want to learn more. A couple. And let's see, we have a couple that didn't raise their hands, so you just were like, I don't like Tiger Time, I want to come here. No? Why else? Why else would you come here? Why are you here? Just interested? I asked you to come. I was like, make sure there's somebody in the room. Good. Okay, so these are the things that I want to talk about with you guys today about physical therapy. What is it? What are some careers that are similar to, but maybe a little bit different than physical therapy? What educational requirements are there for becoming a physical therapist, for those of you who are interested? And then also, what does my patient load look like? What does a day look like as a physical therapist? So just to start off, I went to PED Junior High, then I made it through the high school, which was great. I went to UNI, played basketball for a couple of years, played soccer for a year there, and I'm wearing a UNI shirt because UNI women's basketball plays Iowa State tonight, so that's exciting. If any of you are going to be there, that would be great. Nobody? Okay.
Go Panthers!
So you need to have a 4-year degree, so an undergraduate degree, to go into physical therapy. Physical therapy is a clinical doctorate, so it's a 3-year program beyond your undergraduate degree. Everybody's good, know what undergraduate means. That's college, basically, or university. You can do junior college for a couple years and then go to university, and that's fine. That all counts. There are certain prerequisite classes that you have to do. So if I know that I want to go into a healthcare field, I need to make sure I talk to my counselor pretty early on in either the high school or the college process and make sure that I'm taking the right classes. So for me, as a pre-physical therapy student at UNI, I had to make sure I was taking the right science classes, so I had to make sure I was in the right biology, the right chemistry, make sure I had all the observation hours that I needed. So have any of you guys ever observed someone in their career, ever gone and just like walked around with somebody? What did you do?
I just watched them with their patients.
Cool, so you did physical therapy observation.
Yeah.
Awesome, and you obviously liked it if you're still considering the career. Awesome, what else?
I mean, I watched my mom work a lot. Like,
Cool, and what does your mom do?
She's a dentist.
Cool, so you have an idea of what a dentist is. What did you do?
I watched my mom.
What does your mom do?
Sales commercial.
Cool.
But it's like not physical therapy.
But that's, I mean,
I just watched
no
it
matter
on my
what,
phone.
yeah, no matter what you're interested in, it's important that you see somebody doing that career. Otherwise, you have no idea what really it looks like. So, after you talk with your counselor at the collegiate level or when you're in high school and make sure that you're doing the right kinds of things to keep on track for what you're working toward, then you have an application process. So for me, we do what's called the PTCAS, or the Centralized Application Service, for physical therapy schools. So there's like tons of physical therapy schools. In Iowa, does anybody know there's 4 schools? Does anybody know what the physical therapy schools are in Iowa?
UNI.
No, UNI does
But you
not
said
have
you
a
wanted
program.
UNI.
And then I went to the University of Iowa. I stopped too soon, so I also went to the University of Iowa. So, University of Iowa has a program. There are 3 other programs. I wish I had candy to give you for anybody who knew. No. You have to go a little further. No, not Iowa State, not for Iowa.
College.
No.
Wartburg.
You guys are really good at guessing. So none of those. St. Ambrose in Davenport has a program. Clark University in Dubuque has a program. And then Des Moines University, which is Guess where?
Des
Des Moines, good. So Des Moines also has a program. And so Des Moines University is kind of unique because it has a lot of different medical fields there. So there's DOs or doctors of osteopathic medicine, which is a unique thing. Podiatry or foot doctors there. I think they have a dental school. I'm not sure. Iowa has a dental school,
Yeah, my mom.
but your mom went where?
To Iowa.
To Iowa. Yeah, they have a really big dental school there. So anyway, I did the PT-CAS or the application for physical therapy school, and I applied to multiple schools. There's also schools outside of Iowa, so don't think that you have to stay here, but there are usually incentives for staying in the same state for school. And there's also a big difference price-wise, so that was the other thing that I took into consideration. A state school is about half the price of a public university, and with the student loan debt thing going on these days, I don't know if you guys know, it costs quite a bit of money to go to school. So I think it's pretty important to make sure you've thought through what is your long-term goal before you just start accruing debt or start, adding debt to yourself. I have a friend who is $50,000 in debt right now, and she has a degree in English, but she doesn't really want to do anything with English. So she's pretty upset about that. So just make sure you think it through before you take that jump and begin whatever field you're going into. Yes?
What's the difference of a physical therapist and an athletic trainer?
That's an awesome question. So a physical therapist, like I said, you have the 4 years of undergraduate school, and then you have 3 years to get your clinical doctorate degree. So that's like a graduate school program, or it used to be a master's program, but now it's a doctorate. So an athletic trainer, you have 4 years of undergraduate that is a specific track. Sometimes it takes 4.5 or 5 years for an athletic trainer, and then you can be done. So you can practice as an athletic trainer at that point. Physical therapy, we can bill insurance. Athletic trainers, they can bill certain things under insurance, but they're a lot more limited. So a lot of times you'll see an athletic trainer that works for a school, like a university or a high school setting, or maybe they work in adjunct with a physical therapist, but they don't have the same autonomy. Like they can't just decide, oh, I'm gonna open my own shop and I'm gonna bill insurance for my services of massage, ultrasound, electric stim, things like that. They cannot do that. So a lot of people will go as an athletic trainer for undergrad and then go on to physical therapy school to be able to do more. So it's called a practice act, and that kind of spells out what can you do with your degree compared to another person. So it's different. A personal trainer is far different than an athletic trainer, far different than a physical therapist, and so on. So it's important that you make that distinction early on again, because you might go into athletic training thinking, this is great, I'm just going to be a physical therapist when I'm done. No, not true. Question?
So is a chiropractor like the same thing as a physical therapist?
That's another good question. Is a chiropractor the same? So they're different healthcare providers. So a physical therapist versus a chiropractor, you both do the undergraduate degree, and then instead of going to physical therapy school, they would go to chiropractic school. So Palmer Chiropractic in Davenport is like a major one, and it's usually a 4-year program for chiropractic. Once you're out, they can bill insurance as well. They're doing different services, so it's a different kind of school of thought between physical therapy and chiropractic. Chiropractic is more high velocity adjustments, so you hear about like cracking the neck, cracking the back, things like that. So those are high velocity, quick adjustments compared to physical therapists, which you can actually do that. But more so, there's the exercise component, there's soft tissue mobilization, and so on and so forth. So does that kind of answer your question? Cool. And then any other questions right now? Yeah.
What's the difference between physical therapy and occupational therapy?
Another good question. So we have an occupational therapist that works, I work at Agape Therapy actually, I didn't tell you guys that, but I work at Agape Therapy. What's that? Oh, so you know I work at Agape Therapy. But we have an occupational therapist there who, in the outpatient setting, which is the setting that I work in, meaning everybody can pretty much get to you. You know, you don't have to wheel them in on a stretcher or anything, but they can get to you. They can come in the door and go out the door on their own, so we don't have to help them, which is different than if you're in a hospital setting or in a nursing home. Sometimes people couldn't necessarily move themselves to and from therapy. So an occupational therapist, ours is a hand specialist, so that means that she focuses on hand, wrist, elbow problems. So she's still doing orthopedic types of things. So somebody, here's an example, a guy was using a saw, cut all of his fingers.
Oh my God, that, so the two.
Yeah, so this is a common injury, and so there's a bunch of there's tons of stuff going on in your hand. So cut the tendons, it has to be surgically repaired, so they went to a doctor, a hand specialist doctor. It's important that you go to the right doctor when you have an injury too, just side note. Got that repaired, and so Linda, our occupational therapist, she works with them to regain their range of motion, slowly regain their strength, making sure not to go too early, otherwise you can disconnect the repair, so you can tear that back open if you progress things too quickly. More commonly, an occupational therapist works with what's called activities of daily living, so showering, bathing, putting your socks and shoes on. You know, somebody who is just coming out of the hospital and they're really weak because they just had their hip replaced or something, and they can't reach down to get their socks on. So they're going to teach them, how could I do that in a different way? How can I function with what I need to do, even though I have these limitations? So a lot of times occupational therapists work in nursing homes and hospitals in that way. So, great question. Any other questions? Just for a second. Cool. Okay, so and then I want to tell you guys what it looks like a day in my life. So as an outpatient physical therapist, I see patients for half-hour blocks throughout my day. If I'm evaluating them or if it's their first treatment, I see them for an hour. So that's nice. I get to know them a little better, kind of figure out what's going on. And then the follow-up appointments, we're just working toward their goals. So I want to make sure the first day I figure out, okay, what do you want to have happen during our course of therapy? You have a leg injury and you want to be able to run? Okay, so let's get there, you know? Make sense? Yeah? Question or comment? Smiling at me?
I had that, so I feel like that's.
I did. It was an easy example. So anyway, and so what my therapies might look like with as a physical therapist. Well, first of all, has anybody had therapy? Oh, a lot of you have had therapy. So what are some of the things that you guys went through when you were in therapy? Anybody who wants to share, you don't have to. Yeah.
We have to do a lot of reps.
Doing some exercising. So do you want to share what your particular issue was? If you don't want to, that's okay.
My bone is bone against bone, so I lost cartilage.
Okay, so lost some cartilage. So you had to strengthen up the muscles around it to help support the joint probably. So yeah, you want to make sure that you're progressing them appropriately. If I have somebody who has an arthritic joint or a joint that's bone on bone and I give them, you know, you're going to do 100 repetitions of this exercise with a 100-pound weight on your back and they're not ready for it, they're never going to come back and see me again because they just went home and they couldn't walk for 3 days. So you have to make sure you're slowly progressing them with what they can actually tolerate. And there's an exercise component. Anything other than exercise that you guys have experienced at physical therapy? Yeah?
Did you put like a patch on it with like wires?
Yeah, the electric stim is the classic example. So electric stim is what's called a modality. So it's something that helps to reduce your pain, but it's not the only thing we can do. Usually at our clinic, we do it after we're done with our treatment. So we've spent a half hour with you, and then there will be a 10 or 15-minute session after that with electric stim if you need it. Did it feel good though? Kind of helpful? Yeah, cool. What else? What other things did you have done to you?
Like if you have a shoulder problem, you have to like take a light weight, pull out.
Good. Strengthening the rotator cuff. Awesome. So you saw some very specific exercises, which is awesome. That's great. And so the thing I guess I was waiting to see if anybody had experience is a big component in my treatments are what's called manual therapy. So hands-on therapy where we're actually mobilizing joints, mobilizing soft tissues. So if somebody, say for example, can't raise their arm up over their head because they have a restriction, I'm going to mobilize their shoulder joint so that they can bring that arm farther overhead. And I'm going to work through the soft tissue so that they have less pain with that. And sometimes if you don't address those things, then the person can't figure out how to do it just with exercise. So this is just another element to consider. So working through these half-hour sessions, trying to get a person to their goal at the end of our treatments. Usually it's like 1 to 2 times a week for anywhere to 4 to 8 weeks is how long I'll see a patient for. And I'm trying to think what else. I usually get a lunch break, which is nice. Other than that, that's pretty much a day. So go ahead.
You get to pick your times.
Like how like my day, how long my day is, or you mean like how long I see a patient for?
Yeah, like how long your day, like when you get to meet up with them.
Sure, yeah. So that's a good question. So after the evaluation is done, the patient will schedule either with me or our front desk staff, and they'll decide when they're going to come back. And I have blocked out, like, I work from 8 to 4 on Monday, and I work from 9 to 6 on Tuesday. So I've decided these are the times that are going to be open, and they fill up. So it works out pretty well. If I want to take time off, I have to make sure I do it in advance because I'm going to be working with patients, and they already are on my schedule, so I can't just call them the day before and say, oh, I decided to go on vacation, I don't want to see you tomorrow. You know, I have to plan a little bit in advance, which is a good thing to remember.
How long do you have to plan in advance? Like 2 weeks ahead? Or?
To be able to take time off or something? So most places that you'll work will have a policy. For me, it's at least a month in advance, so I try to be at least 4 weeks out when I'm trying to make my plans. Because also I'm scheduling people for anywhere from 4 to 8 weeks. So if they're scheduling for 8 weeks, I better be on the ball and have my time blocked out about 8 weeks earlier. Does that make sense? Cool. Good questions, you guys. You're awesome. And then I was going to just tell you about a couple of example patients before we get into the fun goodies that I have over here. I have a challenge for you guys at the end of today. So a lot of you probably know that physical therapists can work with athletic injuries, right? Like that's pretty common. That's probably what most of you have experienced personally. I have a patient who had a knee replacement. Do you know what a knee replacement is? Anybody? Okay. Knee goes bad, get a new knee, basically. Her knee got infected, okay, like really deep infection. And they actually had to amputate her leg and the thigh. So that means they cut off the thigh. And she cannot walk right now. She cannot stand and move herself to the bathroom. Her function is very, very low. Okay, so she doesn't have strength and she hasn't received a lot of physical therapy to address that. So what I'm trying to work with her on is trying to get from her wheelchair to standing, sitting to standing, and she basically has to try to balance on one leg right now. Because to get a prosthesis or, a false leg, to be able to get that, you have to be able to perform certain functional activities, otherwise you'll never be able to qualify through insurance, qualify for the prosthetic leg. So what we have to be able to have her do is, if I have 2 chairs here and here, and she's sitting on this one, she has to be able to stand up. She might have to use a walker. She has to stand up and sit down on this one. Stand up and move back. So if we can get her to the point where she can do that, she can have a meeting with Clark & Associates, is who we use in Waterloo. It's a prosthetic and orthotics company. And she can have a meeting with them and they can hopefully fit her for a prosthetic leg. So that is like a huge goal. And when you think about physical therapy, I don't want you to just think about ACLs and hamstring pulls. I want you to think about those people who she came in and she was in tears because she can't take herself to the bathroom right now. She has to have someone help her just to get to the toilet. It's just so crazy to me. So anyway, we're working on that. It's going to be a really long process, but we're working. And she's so excited because last time she came in, we were actually able to get her from her wheelchair to our mat table. So that was like huge, 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 huge. So cool stuff. And then I also work with a group of people who have what's called chronic pain. So I don't know have any of you heard of chronic pain? Have you ever heard of it? Okay, a few of you. So when people have had pain that is out of proportion to their injury, so say I sprained my ankle, within about 2 to 3 weeks it should be pretty much healed. If it's not healing and the pain is getting worse, you're developing what's called a chronic pain condition. There's a lot of science behind it and a lot of research and stuff, but I see a lot of people with chronic pain trying to help them to manage that psychologically. So we're making sure we're working with a psychologist or someone who's working with the mental health aspect of it. And then also the physical therapy to try to get them used to moving again. Okay? So I just wanted to kind of point out a couple different types of patients. So, questions? Anything that I really missed on talking about that you were like, I really wanted her to tell me about this thing? Yes.
Were there any courses in high school, like you said in college,
Yeah.
making sure you're taking the right biology?
Right.
High school, when it's a little bit more basic, what did you take?
The classes that were really helpful to me, I really liked anatomy. That was a great class. And if you take anatomy and you don't like it, you probably shouldn't go into physical therapy, honestly, because physical therapy is very anatomy based. So that's learning about the body, muscles, body systems, joints, all that kind of thing. I also took AP biology, which even if you take AP biology, you will have to take biology again in college, but it was a really awesome foundation. And so then college biology was much more simple for me, and it was a great class in high school. Yeah.
So if you take biology, would it be easier since you know the basics of it, and would you get into it easier?
Definitely. So what I found was so you have to take normal biology, like say you're in honors biology. I don't know what it's called. Is that right?
Mm-hmm.
In high school. So everybody has to take, I think, a biology and a chemistry class. So you've already done that, and then beyond that, I took AP biology, which is an advanced placement class. So a lot of those count for college credits, but if you're going into a science-based major, if you take the advanced placement test, even if you pass it, it still doesn't count for your science GPA, which is something you can definitely talk to your counselor about. But yeah, so it helped me by making that college biology class easier. It was a lot of similar concepts. Does that make sense? Cool. Any other questions right now? No? Okay, So what we're gonna do is I'm gonna show you guys some of the balance and strengthening type of exercises that we do. So we're gonna do a challenge to see who can stay on the Dynadisc, or balance disc, on one foot while using the body blade at the same time, okay? So I have a balance disc over here. This will be the body blade balance disc where I'm gonna be timing you. And over here, people can just practice on the balance disc. And so what you're gonna be doing, choose a foot, any foot. You're gonna be standing up here on one foot. I'll just show you that part first, not both at the same time, because it's really hard. And then you're also going to have your arm outstretched, bouncing this side to side at the same time. Okay? And I want to see if anybody can do it for 30 seconds. Okay? You get one try, and then it's the next person's turn. Okay? So whoever's first, come on up.
Anyone want to try this first? Be the guinea pig?
Who can do it? Let's try.
Mr. Jones!
Oh, I gotta stand up.
Riley, you'll be second.
Good thing you're here to
There you go. You're
give me
gonna
physical
stand.
therapy.
Perfect.
Oh, man.
There you go. Stand on
This is gonna
that.
last for
So
about
this is
15
gonna be arm out
seconds.
straight. Wait, gotta keep it moving. Yeah, there you go.
go.
Okay, that was like 4 seconds. Great job.
Everyone
All
clap.
right, Josh,
Who's
next.
next?
I gotta pick who's next. You.
And I'll just time you, so I'll tell you if you get to 30.
You didn't even beat me.
Yes, that was about 3. Yeah, good job.
So, Kristen, what are you testing for to see if students can do this besides maybe balance?
Right, so
What
balance
line's better?
and yeah, you know, dominant or non-dominant leg. The body blade is adding a dynamic force. So you're going to use your core to stabilize your shoulder. You can go ahead. And your shoulder to stabilize while balancing on one leg. I figured this was not gonna be hard, so keep going. Whoever's next. Maybe 15 seconds is more reasonable. Let's go for 15.
All right, Sam, you can do this. You're a gymnast.
We, tonight's at
Ooh! Keep that body blade moving.
We do have.
Keep it going. Keep it going. Arm straight. Arm straight out in front of you. Keep it going. Good job. Keep going. 5 more seconds. Really? 3? Yeah. Awesome. Keep going. Let me see how long you can go. Okay, so about 18 seconds. That was awesome. Way to go.
Good job.
And obviously, if you have any injuries, please don't do this if it's going to hurt you.
I'm good now.
You're good.
Yeah, I'm at.
You don't want to.
My food.
Maybe you can let me know.
Olivia, you don't want to. Good job, Riley. You can do it. Just give it a try. There you go. Okay. I'm literally like, oh, there you go. Good. Keep going. Keep that elbow straight. Shake it side to side. There you go. Okay, this is really good. Oh, you're doing so good. You have better balance than I did. It must be those Converse.
Practice.
You guys have? Did you have one last night?
Okay, job.
You're gonna fall off.
It's so weak. Sam, nice job. I didn't bring anything to give you for winning, but good job.
eel has candy in her room.
Perfect.
Yeah.
You can tell her that I sent you. So this eel is my sister-in-law.
Oh, perfect.
Yeah.
Did you guys catch that with Kristen Eel, Mrs. Eel?
I thought of that, but I didn't know.
My brother is married to Mrs. Eel. Everybody calls her Mrs. Eel, but Mrs. Eel. So, yeah. Anybody have any other questions? I think we're close on time here. So.
We were close. Any other questions?
You're gonna hit yourself in the head.
All right, if you guys want to give Kristen, Ms. Eel, a hand.